why healthcare? As a we're buffet of opportunities out there. What drew you to this space initially?
Well, unfortunately, Jordan, when I was 15 years old, my mother passed away of breast cancer at the Princess Margaret Hospital. And then when I was doing my Master's of Health Administration at U of T, we had a chance to do a practicum placement for that program. And you selected three hospitals. I was fortunate enough to be selected by the Princess Margaret Hospital to go back into that environment. And I think what ignited my passion for healthcare and health system transformation, for research, for innovation in that environment, was just the learning culture that the Princess Margaret Hospital represented. And it sort of drew you in, and you met a bunch of great mentors, leading edge researchers, leading edge thought leaders in oncology. And they inspired me for the 7 years that I was there to continue my career in health services and health research and innovation. So that was sort of the unfortunate part, the death of my mom, but then that led me to wanting to give back, wanting to do more, and wanting to help transform the health system for better.
And so that deep personal connection, then obviously that must have been very difficult going through that at a young age. Cancer care, of course, you always being on the cutting edge in terms of medical and developments and technology. I mean, did you yourself know you really wanted to be in that innovation space early on, or how did you get pulled into that side versus, say, healthcare delivery itself?
Yeah, so when I was there, I was what was called the corporate staff assistant, reporting to Dr. Don Carlo, who was the president and CEO at the time. I worked also with Janet Bede, Susan Connor, and Simon Sutcliffe, my mentor and friend. And so that was on the administrative side. Jordan, you're correct. And what drew me over to the research and innovation side was just the research and innovation culture of the Princess Margaret Hospital. But there was one signature project I took on, which was the review of the clinical research at the Princess Margaret Hospital. So I was teamed with Dr. Jim Till. I don't know if you know Dr. Jim Till, but Dr. Jim Till and Dr. Bum McCullough discovery led to the creation of stem cells. They had actually discovered stem cells, so they were involved in the clinical research review. And again, you wouldn't know Jim Till, but he had a passion, and he really drew you into his orbit, and that inspired in me a sense of the research innovation world. And I guess I've kept that even though I pursued administrative roles. And then when the opportunity came up in 2002 with the Michael Smith Foundation for Health Research, it was too good to resist. So I actually moved over and applied and was recruited to be the inaugural Senior Vice President of Corporate Services and Programs with the Michael Smith Foundation for Health Research. And that was about 20 years ago. And the rest, as they say, is history. I don't think I'll go back. I'll stay in the research and innovation space.
Healthcare innovation's gotten its claws into you, I guess. It's hard to escape now.
It gets under your skin. It gets into your. It's something that, in a good way. I don't think it's a bad thing. It's a good because you're working with red hot people in terms of ideas, mentors, and it draws you in. Very much like the Princess Margaret Hospital drew me in. It was very much a learning culture, and as I said before, Jordan, that culture greets you at the door. It's something you can't really describe or put your finger on, but you know it when you see it and you feel it, and then you get drawn into it. So it's a very exciting place to work, and I've kept that for the majority of my career.
No, that's awesome. And I mean, just like the magnitude of impact one can achieve over the course of their career when you're supporting the supporters, right? When you're working on those systems level problems, I imagine that just, is so far reaching.
Yeah, I mean, obviously, when you work in a cancer system, you're working for an organization, but the vision of the organization is a world free of cancer, right? So how do you achieve a world free of cancer? It's obviously outside the four walls of the institution, and you're always trying to go upstream and to help prevent cancer where you can. You're trying to change the mindsets around where you put resources, where you put your time. And I guess now with all the tools we have at our disposal, artificial intelligence, machine learning, the ability to predict, really data analytics, these things are really transforming healthcare. So in oncology, if you take a system perspective, again, that's something that stuck with me. And I mean, some of the stories were, basically if you can get upstream for a lot of the patients that arrive at a cancer facility, unfortunately, for some, it's too late, right? So you want to be able to go upstream in the process and intervene as quickly as you can to give people the highest probability of a downstream outcome success, right? So that should be the goal and vision of our healthcare system.
I'm Dr. Jordan Valrath, and you've been watching Cherry Live, brought to you by Cherry Health. Please like and subscribe to see more clips like this, or check us out at www.cherry.health, Canada's medical network.